We at Zeltiq care deeply about results. In consultation with clinical experts around the world, we have developed this simple guide to proper procedure planning. This guide is broken into 3 steps: assessing the fat, planning where to place the applicator, and placing the applicator. Assessment will outline how targeted fat should be evaluated and when good tissue draw can be obtained. Good tissue draw will place sufficient tissue in contact with cooling panels. Contact with panels is directly related to outcomes. Begin by having the patient stand so the fat is subject to gravity. Using your hands, pull the fat from the body and form it into a U shape, approximating the size of the applicator opening. By mimicking the opening, you can better assess how much fat will be drawn. As a general rule, you want at least 1 inch or 2.5 centimeters of fat drawn into the cup. If you identify that there is not enough fat available to obtain good tissue draw, consider repositioning the cup to an area that can get a better draw. To summarize this step, have the patient stand, form a U-shaped cup, and manually evaluate the amount of fat that can be drawn. Assessment is an important step in selecting suitable patients. Knowing when there's enough fat to get good tissue draw will play a significant role in eventual outcomes. Planning will outline how to identify the number of cycles necessary and will mark the area for applicator placement. Fat presents as both discrete bulges and continuous sections. The abdomen, for example, often has 2 discrete bulges, one on either side of the umbilicus, while a love handle may be 1 continuous section. Discrete bulges require a single placement. Continuous sections of fat may require several placements, one adjacent to the other. To plan more than 1 placement, use the procedure area planning template. White lines on the template represent the edges of the cooling plates. To treat the maximum amount of fat with each placement, you should take care to orient the applicator along the center line of the bulge, however it presents. Back fat, for example, may run along a diagonal. Mark points on the tissue with an X next to the white lines of the template, as well as at the center point of the template. If appropriate, shift the template left or right to mark each adjacent area. To summarize this step, identify whether the fat presents as a single bulge or continuous section. Additionally, identify the actual orientation of fat bulge. Mark the targeted fat. For single bulges, mark the peak with an X. For continuous sections, mark both the edges and the center point of each individual section. The objective of the placement step is to attach the applicator securely to the patient and position the patient for the duration of the procedure. Begin by putting the patient in a position that relaxes the treatment area. For example, abdomen patients will ideally be lying at an angle. Back fat patients will be seated with shoulders relaxed. And love handle patients will be standing when the applicator is placed and then asked to sit. Once the patient is in position for placement, remove the gel pad from the container and check for tears or rips in the material. If there are any issues with the gel pad, use a new pad. Apply the gel pad, centering it on the X that was made in the previous step. Recheck the gel pad for tears or rips. Gently smooth out the gel pad with the back of your finger to remove any wrinkles or air bubbles. Turn on the vacuum and center the applicator directly above the X on the bulge, making sure the applicator is angled in the direction of the bulge. Depress the applicator straight onto the target with enough pressure to form a seal around the edge of the applicator. This enables the vacuum pressure to gently draw the fat into the applicator. Once the applicator is in place, position the patient to make them comfortable. Rolled up towels, boppy pillows, or other items can be used to support both the applicator and the patient's body so that the patient remains comfortable during the procedure. To summarize the place step, position the patient so target fat is relaxed. Remove the gel pad and check for rips or tears. Center the gel pad on the X and smooth it out. Apply the applicator to the target. Confirm that tissue has been drawn into cup. Reposition the patient and support the applicator to improve comfort. Following these simple steps will help you optimize your outcomes and maximize your opportunities for satisfied patients.